Hi everyone, this is Dr. Selman. Well, today's question is, how long is an IVF cycle abroad? The answer varies depending on what type of IVF procedure you're going to have and what protocol your doctor is going to use. In this short video, I will try to give information about different types and treatments we may use while you're having IVF in Istanbul, Turkey. There are many protocols and methods actually, but usually there are two main types, the long and the short one. With the long protocol, which we have used for many years in the past, injections are given about 10 days before the period starts to suppress the ovulation in the next cycle. In short protocol, we use different types of medications to prevent from spontaneous ovulation. With IVF, the eggs should be collected just before the ovulation occurs. In Medicana, we mostly use short protocol because we prefer to see the women at the beginning of the treatment before starting any medications. This gives us the maximum safety and the success rates as well. As we start the stimulation, most women will need to take injections for 8 to 10 days, and then we give the final shot for triggering the ovulation, and 36 hours after this final injection, we collect the eggs under general anesthesia. The next thing to figure out is whether you're going to have a fresh or a frozen transfer. A fresh transfer is performed 3 to 5 days after the egg retrieval. So if you're able to start your stimulation on the second or third day of the period, it will probably last for 17 or 20 days, including the embryo transfer. You will be able to travel next day after the transfer has been completed. However, most of the successful IVF programs all over the world are rarely doing fresh transfers today. In Medicana IVF Center, we also mostly prefer freezing all the embryos and then put them back in the uterus at a later time. Why? Well, there are some reasons for that. First of all, this will give us the chance of using medicines liberally and having more embryos of good quality, which would increase your cumulative pregnancy rate. And this divided protocol may also help if you have time or work limitations to spend 3 weeks abroad. And more importantly, it will prevent from the risk of hyperstimulation completely, which might be seen sometimes with the fresh transfers. That means frozen embryo transfer is the safest way for IVF. You may have a look at another video for more information about hyperstimulation syndrome. So briefly, if you come here for approximately 12 days for the first part, you may return to your country next day after the egg retrieval, and we'll observe your embryos in the lab for 5 days and freeze them into groups. We recommend at least 1 month of resting period, and then you may start preparing for the embryo transfer in your home country and come here again for only a few days, even for 1 day. Husband doesn't have to come again for transfer. Well, I tried to give an idea about the duration of different protocols. Remember that in Medicana, it is always your decision to have a fresh or frozen transfer. We perform both methods and the success rates are almost the same. If you have any question, you may leave it in the comments below. We'll answer it soon. And we are planning to release a new video weekly. Please subscribe our channel for other infertility videos.